Hi, my name is Tammy Tyree. I've been a nurse for about 33 years and an acute care nurse practitioner for 23 of those years. I've spent about 99% of my nursing career in neuroscience and currently work clinically as an inpatient neurosurgery nurse practitioner. During my years in neuroscience nursing, both as a registered nurse and as a nurse practitioner, I've seen several neurocritical care staffing seasons. There were times during my career where it was difficult to find neurocritical care ICE or neurocritical care bedside nursing positions. And then there were other times during my career where neurocritical care bedside nursing positions were impossible to fill. That's why I found the new article by Doyle et al. Entitled Consistently Exploring Nursing Staffing and Neurocritical Care Unit Turnover fascinating. You can find that article in the April 2024 Journal of Neuroscience Nursing. I think that this is such a timely study because of the COVID pandemic. I feel like the authors are spot on with their timing as well as completion of this study. Prior to the pandemic, the author's neurocritical care unit primarily based their staffing on patient acuity needs. However, as in most locations in the country, the pandemic contributed to severe staffing shortages, specifically nursing shortages, as well as other provider shortages. But not only during the pandemic, also the fallout after the pandemic as well. With these staffing shortages, the unit within the study had to resort to a more centralized ICU staffing model, as opposed to their typical acuity patient acuity staffing model that they were used to. What they found in their study was that this caused a statistically significant increase in average nurse to patient ratios. It also caused an increase in the incidences of nurses being floated or pulled to other critical care units. During this time frame, what they also found was that the neuro ICU saw a 180% increase in nursing turnover in that particular unit. While it's difficult to say whether the transition from acuity-based staffing model to the necessary centralized staffing model was directly responsible for this drastic nursing turnover rate, the reader can almost surmise that it likely did contribute. With this current state of nursing shortages post-pandemic, I think this is a very important article for all stakeholders in neurosciences to read. This study will give us insight into not only a potential contributor of neurocritical care staffing shortages, but I think it'll also give us some insight into how we can learn which staffing models work and which staffing models might not work so well. I would encourage you to read this important study, but I would also encourage you to share it with your neuroscience colleagues. Specifically, I would encourage you to share this important information with the management team at your specific institutions. Thank you so much, and thank you to the authors and the contributors to this study.